A very good evening to one and all present over here and are going to listen to us later as well. Firstly, I really wish that all pregnant mothers and all pregnant families and couples, they are going to listen and get benefit of today's session. Myself, Dr. Pankhuri, and I am a consultant physiotherapist, and I am a women's wellness expert, and my specialty is to work with pregnant mothers and help mothers with their postpartum time. And I am a certified lactation care counselor from USA. Today I would really thank BabyChakra and Naina for giving me this opportunity. And today it's a very special session wherein we are going to share 7 important tips for helping you to have a safe and calm birth, especially during this COVID time. So let's start with the first tip, which I want to give the pregnant mothers is that you should really understand that you cannot birth lying flat. So just stay out of that back and do not lie down flat when you are in labor, and understand that it takes the role of gravity to act in the process of labor and to make it a smooth process and to even shorten the time of labor. So remaining off your back will really help. So what are the ways in which you can remain upright and use the um, effect of gravity? Number one, you can stand. You can stand around your bed in the labor room and get help from the nursing staff, get help from your birth partner to make you stand. And you can definitely walk between the relaxation from the contractions, and learn more positions from your antenatal care provider. So it's very important that you practice all these things now when you are pregnant, because this 9 months of time has been given to us by God to help us learn the basics of birthing, and to mainly get acquainted with the process of labor. So it's very important that we understand that we cannot lie flat like we see in movies and cinemas, that women are mostly birthing in the flat position. So it's very wrong and it's not required. So you need to learn some new positions and understand that you need to stay off your back. So now, tip number 2, you should have a great 24 by 7 birth support. Now, what do I mean by birth support? Birth support can be given by your husband, can be given by your mother-in-law, or someone who understands you and can calm you down, and whose presence will make you content, happy, and you will feel secure. So it's very important that your birth partner and you both are educated in how together you will be able to birth the baby normally. So basically, there are certain things by which the birth partner can help the birthing mother who is in labor, especially by creating a safe environment for the birthing mother. So, if we say that a mother in labor should walk, should stand, should be upright, should be sitting upright, so it's the role of the birthing partner to help the mother to be upright and to make her secure, to calm her and relax her so that she can so that she can continue the process of the long labor if she is going into. So here we need to understand that the environment should be such that the birthing mother feels secure and calm, and that can be very well done by the birthing partner. The birthing partner can keep the mother hydrated by providing her food and water at adequate times. And the birthing partner can make her relax by playing some soothing music. The birthing partner can also give her light, gentle massages on the neck and back, and give her some you know, music therapy, aromatherapy, and help her relax so that she can shorten the time of labor. Because if she's relaxed, automatically her labor time will be shortened. So now, it's very important for us to understand that the presence of a good birthing partner can actually lessen the chances of medical interventions by 40% and can actually reduce the chances of C-section by 30%. So the presence of a good birthing partner is all you should look for. So prepare yourself, prepare your birth partner, your husband for this labor time so that you can deliver the baby normally. So it's very important for us to understand that the tip number 3 here will be how to relax, relaxation. Now, relaxation between the contractions is very important. Here, we need to understand that, as soon as a mother goes into labor, so the time of the contraction is far, and then it becomes very close with time. So here we need to understand that between the contractions, the mother should relax. The mother can relax only and only by the support of the birth partner, by the support of the medical team. So here it's very important that she visits her birthing place beforehand and is not anxious at a new place. So she can visit the recovery room. She might not be allowed to visit the OT, but then she might just go and see where they are going to take her if she goes into labor, the labor room. And it's very important for her to be familiar with the hospital surroundings. She should also take a room tour, because she should be very comfortable with the room and the bathroom inside the room. So here we need to understand that all these small changes will make her calm and relaxed and will give her the necessary strength to go through the labor. And it is also seen in a lot of studies that mothers who are relaxed and calm proceed to a normal delivery, and their labor time is also very short. So we are looking for doing that labor time short and making it short. And so here we need to understand that for that, a mother should be very, very relaxed. Now, it's very important for us to understand that the birthing partner's role is of utmost importance. So, how she can get relaxed is also by the help of tip number 4, which is breathing. So, it's very important to understand that breathing actually calms your nervous system. So, the more you breathe, the more calm you become. Now, you will say, it is not a new thing. We all breathe, we keep on breathing, but it's not like that. When we are pregnant, we need to breathe in a certain way, and for that, we need to take a guidance from our antenatal care expert, our pregnancy wellness expert, and they can guide us in the correct amount of breath work we need to do when we are in labor. So it is timed according to the contractions. The breath work is timed according to the contractions. And so here we teach mothers in the antenatal classes how she can breathe to improve her cardiovascular stamina so that she can withstand the labor hours. All right. Now, tip number 5 is gaining optimum weight. Now, what is here to be pondered about is that it's proven that only 42% of pregnant mothers gain optimum weight. Then there are only 30% of the mothers who there are 42% of the mothers who gain excess weight, and there are 32% of mothers who gain very less weight. So the chances of medical intervention and the chances of C-section increase in this population, which gains excess weight and which gains inadequate weight during pregnancy. So here we are looking at gaining optimum weight when we are pregnant, so that our chances of normal delivery increase and our labor time shortens, and we are having the strength to sustain the labor. So how do you gain optimum weight? Is by having a great nutrition plan and a great exercise plan. Now, it is recommended that a pregnant mother should be active for around 1.5 hours every day. So, this activity level can come from walking, from non impact aerobics, pregnancy Pilates, pregnancy yoga, pregnancy strength training, and it is recommended for her to work out at least thrice a week by using dumbbells and doing strength training workouts. So it's very important for her to gain optimum weight in order to get her close to the normal delivery. Now, tip number six. Tip number six will be to take benefits of the childbirth education classes. Now, childbirth education can come from a lot of pathways, like you can read some excellent books available on childbirth classes, on education, on Lama's education, or you can join some independent classes on childbirth education and Lama's education, which has an different impact, in where you can learn face to face from the educator, and the expert can guide you with all the breathing, the exercises, the nutrition which is required for you to in order to gain optimum weight. So it's very important that we understand that mothers who exercise during their pregnancy also have quick recovery after the delivery, which we all want, because we all are working and we want to rest very few days and then bounce back to our work. So it's important that we rehabilitate quickly after the birthing process. So the seventh tip for today will be to choose a good care provider. Now, a good care provider will be a care provider who will be able to solve all your queries, who will answer all of them with love, and whom you can trust, and the hospital wherein you feel safe, secured, and trusted. So, always choose a gynac whose normal delivery rates are good in number, and can assure you that you and your baby will be very well taken care by the staff. And also, I would like you to take the breastfeeding sessions while you are pregnant, because a lot many times the mother is after the procedures, whatever she goes through, maybe normal delivery, maybe C-section. It's a very sad scenario, especially here in India, that a mother is told to take rest and is not allowed to breastfeed much. And if even if she's allowed at some places, she's only allowed to latch for around 5 minutes or so, which is very wrong, which is inadequate. So a mother, if she is birthing normally, and if a mother who has undergone C-section and all her medical parameters are in control, should feed right in the OT for 45 minutes at least. So it's very important to give and take the advantage of the first golden hour after birth, wherein the mother and baby are together, skin to skin contact is maintained, and the baby is latched on the mother and is allowed to be on the breast for around 45 minutes. So these were my 7 tips for today, and I hope you have a safe and calm COVID birth. So here we are. I'm Dr. Pankhuri, and I can be of your help if you are pregnant and looking for prenatal classes. So I think it's time we take certain questions. So let's listen to the questions. So the first question is, what to do to relieve back pain during pregnancy? Now, back pain is again a consequence years of poor posture, and especially when we are pregnant, it can aggravate if we are still not improving the posture and not doing back strengthening exercises as well as core strengthening exercises. So it's very important for a pregnant mother to learn how to sit, stand, and move in a particular way when she's pregnant, so that her hip is not tight, her hip muscles are not tight, and there is good mobility in the spine and the hips. So again, it needs supervision, and it needs you to attend the physiotherapy sessions by an antenatal expert physiotherapist. How to stretch lower back while pregnant. All right, there are a lot of exercises. See, no exercise is unsafe during pregnancy. It depends when you are doing it and how you are doing it and with whose supervision you are doing. So please understand, there's nothing which is restricted, but it should be done under supervision. How to manage spasms during pregnancy? A lot many times mothers complain of spasms and sprained phalanx during pregnancy. That can be because of lack of exercise, lack of mobility, and lack of proper nutrition. So please work on the nutrition. And there is something which is known as creatine. So we need to understand that, are we getting creatine through our natural food sources? Then why do I have pain during first trimester of pregnancy? See, again, it's a very subjective thing. Without assessment of the patient, of the client, of the pregnant mother, we cannot say anything why she is having pain. But yes, pain can come from the new changes the body is going through and the failure of the body to take it. So here we need to understand, in the first trimester, it's very important that we allow the body to stretch and we allow the body to do some mobility work. Can pelvic pain be associated with pregnancy? Oh, yes. Pelvic pain can be associated with poor posture during pregnancy. So, a lot many times we have noticed that mothers do not have a good posture, especially when they're sitting, they're standing. So, it's very important that we correct the posture. We give her the education about the correct posture. How many counts of squats, exercises, stair climbing has to be done? All right. Now, this is a very uh, complicated question, because then again, it depends upon person to person. We cannot make, there's no one rule that fits everyone. So here we need to understand that we customize the exercise plan according to a particular mother and assessing her personal needs. Okay. Daily routine of exercises. There are a lot of exercises. If you are interested in prenatal exercises, you can join our sessions. We take online Zoom classes every day. Can we go for jogging? It all depends upon your pre-pregnancy level and what you did before getting conceived. So if you want, we can talk on this on a personal level. Is it normal to have body aches during pregnancy? It's not normal. Body aches are not normal. We need to rectify, we need to identify the root cause of the pain, and then it can be very well managed through exercises and good posture. What are some bad signs during pregnancy? There are a lot of things which can go wrong when we are pregnant. So we need to understand, it's very important to keep a good posture, to be well hydrated, to understand that we should eat on time, and what we are eating should be rich in good quality protein, good quality fats, and good quality carbs. Why do I ache all over? Again, it can be anything. It can be a vitamin D deficiency. It can be a calcium deficiency, result of a poor posture. Why do my legs hurt so bad during pregnancy? Um, Probably lack of movement. Our bodies want movement and are designed to move. So we need to understand in what way we should move. So, in all these questions, one thing is my answer that you should take the help of a antenatal expert physio near your place, or you can contact me directly. So, it seems a lot of women are having a lot of pain and aches. So, I think I will not advise you to do hot fermentation, take painkillers. No, that is not we are looking for. Okay, we are looking for a solution which will help us to understand our bodies. So when you join the antenatal classes, you understand your body's limitations. You use your body to do exercises, to do body weight workouts. Okay, so here we should know that we can do all forms of exercises, as I have already told. We can do pregnancy Pilates, pregnancy, yoga, aerobics, strength training, breath work, meditation, to keep a balance between your body. Because a lot of women undergo and experience pain. So here we need to understand that this should not get aggravated and can very well be managed by simple techniques of exercises, posture correction, food management, and relaxation. So I hope I've done my best and I have guided you in today's session. So if you need any help, you can contact me personally. All right. Thank you and have a safe and calm birth.